Autism spectrum disorder (ASD) is a developmental disorder that affects social interaction, communication, and behavior. Early detection of ASD is crucial as it allows for timely intervention, which can significantly improve outcomes for children. Screening for ASD typically occurs during regular pediatric checkups at 18 and 24 months of age, when early symptoms often become noticeable. This essay explores the early signs of ASD, the screening process, diagnostic criteria, and the importance of early intervention. Before we begin, please note that this video is intended for informational purposes only and should not be considered medical advice. Any errors or inaccuracies in the content are solely our responsibility. We strongly encourage viewers to conduct their own research and consult with healthcare professionals for any concerns related to autism spectrum disorder or other medical conditions. Our views and opinions are independent of any organizations or sources used in the creation of this video. Always seek advice from a qualified doctor or medical professional for personalized care and guidance. Early symptoms of ASD. Early signs of ASD can appear as early as the first year of life, although they may not be immediately recognized by parents or healthcare providers. One of the earliest indicators is a lack of response to one's name by 12 months of age. Typically, by this time, babies should respond to their name by turning their head or looking toward the person who called them. Children with ASD may not exhibit this response, which is often a red flag. Another early sign is the absence of pointing to objects of interest by 14 months. At this age, children usually begin to use gestures to communicate their interests, such as pointing to an object they want or find intriguing. Children with ASD may not use gestures in this way, potentially leading to communication delays. In addition to these behavioral signs, children with ASD often avoid eye contact. Eye contact is a critical aspect of social development, and a lack of eye contact can signal difficulties in social communication. Furthermore, repetitive movements, such as hand flapping, rocking, or spinning objects, are common behaviors in children with ASD. These repetitive actions may become more pronounced as the child grows. Other early signs may include unusual reactions to sensory stimuli, such as overreacting to loud noises or underreacting to pain or temperature. Another symptom, often noticed as early as 18 months, is echolalia, which refers to the repetition of words or phrases, sometimes in a delayed or mechanical way. While echolalia is a natural part of language development for some children, when it persists or becomes excessive, it may indicate an underlying issue like ASD. Screening for ASD. The MCHAT will assist in identifying ASD in young children. Healthcare providers often use screening tools, such as the Modified Checklist for Autism in Toddlers MCHAT. The MCHAT is a parent-completed questionnaire designed to assess a child's risk for ASD. It includes questions about a child's behavior, communication, and social interactions, and is typically administered at the 18-month and 24-month well-child visits. If a child shows signs of ASD or scores high on the MCHAT, further evaluation is recommended. However, it's important to note that no screening tool is effective after 30 months of age. By this point, children may exhibit behaviors and developmental delays that are harder to distinguish from other developmental conditions, and the window for early intervention is closing. Diagnostic criteria for ASD. Diagnosis of ASD is based on the identification of specific social communication issues and restrictive, repetitive behaviors. According to the Diagnostic and Statistical Manual of Mental Disorders DSM-5, a diagnosis of ASD requires that a child demonstrates 3 social communication challenges, such as difficulty with back-and-forth conversations, reduced sharing of interests or emotions, and difficulty in understanding or maintaining social relationships. 2 for restrictive or repetitive behaviors, which may include repetitive movements or speech and intense focus on specific interests. or inflexible routines. To ensure an accurate diagnosis, a thorough evaluation is necessary. This typically involves observations by developmental specialists, detailed history taking from caregivers, and standardized diagnostic tools. The evaluation may also include assessments for other conditions that could be affecting the child's development. Comprehensive evaluation and early interventions. ASD is suspected or diagnosed. It is essential to conduct a comprehensive evaluation to address any other developmental concerns. This may involve several specialists, occupational therapy (OT) to assess sensory processing and fine motor skills, physical therapy (PT) to evaluate gross motor skills and coordination, audiology assessments to rule out hearing issues that could be affecting communication, visual assessments to ensure that vision problems are not contributing to social and communication difficulties. Additionally, early intervention services such as speech therapy, behavioral therapy, and specialized school programs are crucial in helping children with ASD develop social, communication, and adaptive skills. Early intervention has been shown to have a positive impact on a child's long-term development and can significantly reduce the impact of ASD on their everyday functioning. Genetic testing for ASD. In some cases, genetic testing may be recommended to further explore other potential causes of developmental delay. Concerns. Common genetic tests include chromosomal microarray testing, which looks for chromosomal abnormalities that may contribute to the condition, and Fragile X testing, as Fragile X syndrome is a genetic disorder that shares some overlapping features with ASD. Conclusion. Early screening for autism spectrum disorder is essential for identifying children who may need additional support and intervention. By recognizing the early signs of ASD, such as not responding to their name, avoiding eye contact, and engaging in repetitive behaviors, parents and healthcare providers can take steps to secure a diagnosis and initiate early intervention services. Tools like the NChat are critical for identifying at-risk children during well-child visits at 18 and 24 months of age. Following a positive screening, a thorough diagnostic evaluation is necessary to confirm the presence of ASD and identify any other developmental concerns. Early intervention, which includes therapies and specialized educational services, plays a key role in helping children with ASD thrive. Additionally, genetic testing can provide useful insights into the potential causes of ASD. With early recognition and appropriate support, children with ASD can achieve significant improvements in their development, paving the way for a brighter future.